So, good morning, students. Today's lecture is about animal bite, the most famous topic of Department of PSM, and not only for PSM, it is important for life also. Like if you are going to get bitten by animal, what you are supposed to know, we will be discussing in UG and briefly at PG level. So this is a lecture by myself. I am Dr. R. Balasubramanian. I'm a senior resident of Department of Community Medicine, and let's start with the class. So why animal bite is important? Yeah, I think you might have seen the slide because it is after animal bite we are going to suspect something bad is going to happen to us. Most important infection is rabies. Yeah, rabies. What is the first thing that comes to your mind when thinking of rabies? Dogs, right? So this is a classic Tom and Jerry example. So most of the rabies cases, the perpetrate, that is the villain, will be a dog. That is a rabid dog. Rabid means it is a mental dog. So that is the literal meaning of rabies. So if someone asks what is rabies, what you are going to tell as undergraduate student is that it is an acute, highly fatal, and it is an which infection? Bacteria or fungal? No, neither. It is an viral infection. So from where it is going to spread? I mean, like at what route it's going to spread? There are so many systems like mental, skeletal system, muscular system, and our rabies is going to spread via the CNS, that is the nervous system. So, and you can tell the classical example, rabies person will be having hydrophobia. So what's hydrophobia? Let's split the word. Phobia means fear and hydro means H2O, that is water. So fear of water, not only drinking of water, but even seeing of it is rabies. So why it is important? There are so many diseases, right? There are coronas there, and there are AIDS. There is tuberculosis, which is ongoing, and there are so many new infections which is coming like monkeypox and so many viruses. But why this virus is most important? Because it is 100% fatal. Like if you get the case, I mean, like if you got the virus, you are going to die it without any treatment. And it is accounted around 55 deaths, and this is only WHO data, which is outdated data because WHO is not publishing data, no reason data. It is around 2004 data, and obviously we can tell that the death is will be on the higher side itself. So 55,000 deaths, confirmed deaths of rabies per year. So see this news outlet: a Ghaziabad dies of rabies who hid the dog bite from parents over a month. So because he hid the dog bite, he got rabies, and means he did not have any proper treatment and he died. So why it is important? Like everyone dies, right? You die one day, I die one day, and everyone in the world dies one day. But why death due to rabies is important? There are so many diseases also. RTA, corona. Why rabies? That is the important question. Why everyone is talking about rabies, and we have specialized OPD, outpatient department, specifically for rabies? Because I have given a clue. Because in OPDs, what they give? They give vaccines against rabies, and rabies is one particular disease because it is 100% preventable. Okay, if you have the vaccine, I mean, if you have the virus in you, and if you are given with the vaccine, so it is 10% chance that it is preventable. So rabies is a preventable disease, 100% preventable under good immunization cover. So let's move on to the epidemiology. So what is epidemiology? So in a simple word, how the disease is spread from one person to another, and how the disease is in the nature, and how the disease uh, manifest in different species and different persons is the epidemiology. So we also know there is a something called as epidemiology triad. It is an important question. So in this we will be seeing agent, host, and environment. Who is an agent? Agent is the one who's carrying the disease. So uh, agent is the one who is going to carry the disease, and host is the one who is going to harbor the disease. He is like a car. He is going to harbor the passenger. That is the disease. And environment is the place where both the agent and host meet. So this is the epidemiological triad simplified. So our agent in rabies is a virus, particularly called as a Lysa virus of the family Rhabdoviridae. It is simple to remember, right? Rabies, rhabdo. So this is the structure of the rabies. This is important because we will be seeing, because not only from the microbiological view, but also the vaccine itself has a significant effect over the shape and the structure of the viruses. So let's see. So the virus is bullet shaped virus. It is a bullet shaped virus. So what are the parts? So outside it is the envelope. It is the most important part, and inside there are so many RNAs. There are mRNA, M protein RNA, and M and N protein RNA along with G protein. So the proteins are not important for our aspect. So only concentrate on the envelope. So it is a bullet shaped virus and it is an enveloped virus. Okay. So remember this photo. We will be seeing why it is important in the later stages of the slides. So there are four serotypes. There are type 1, type 2, type 3 and type 4. But type 1 is the most important of all because it is the most antigenic, and all the antibodies are produced, I mean all the vaccines are produced against the type 1 virus only, because other three strains are not that much antigenic. So that is the why type 1 is the one we are going to concentrate. Source: from where does the rabies comes? So 95%, we have seen the first slide, 95% comes from the dogs, that is the canines. But other carnivorous mammals can also harbor the virus, like um, in developed countries mostly bats and raccoons and skunks. But in developing countries mostly the rabies is spread by bite of canines, that is the dogs. So it is specific alignment towards mammal, that is the species which gives milks to their young one. So it is especially inclined towards mammals, and where it is that it resides in their saliva. So from the virus, it spreads in nervous system, but it mostly uh, gets secreted, and it is ready to be infected to other person, waiting to be bitten to the other person, and it is waiting to be in their saliva. So mode of transmission, how it is transmitted from one species to other. So we have already seen by bite. So the bite has saliva in it. So this is the teeth. So saliva will be dripping from the animal, and human to human transmission is also told theoretically possible. So let's say if a human is rabid and he bites another person, if there is a bleeding, yes, theoretically it is possible, but practically there is no accounted cases like that. But still we are going to do prophylaxis for the persons who are surrounding the rabbits, uh, rabid persons. Excuse me. Okay. So what is the myth? Myth around rabies is that eating the infected meat will going to have rabies. So that is not true. eating of the infected animals meat is not going to spread rabies in the affected person. So what are the hosts? Who are the hosts for the rabies? They are the canines. So the canines, they will be having rabies in their saliva, that is the teeth. So the rabies, when it bites the human, it is a dead end hoods. Humans is not going to bite, or he is not going to give his saliva to any other person who is critically ill. So it is not a natural way of traveling of the disease. But what can happen is that if the animal, the rabid canine, is going to bite a cow, the cow will be eliciting the rabid symptom like excessive salivation. So when that happens, if this saliva is in contact with other bovine, other nearby cow in the shelter, then it's going to spread. So it leads to a natural history of disease. So this is the how the disease spreads from the host to the other species. So what is the incubation period of the rabies? First of all, what is IP or incubation period? Incubation period is the period of it is a time taken for a disease to elicit the symptom. Meaning, if a person is getting the rabies from a bite, from the time of bite, if you start the clock, if you count the days, and till he is going to have excessive salivation and other rabies problems, this is called as an incubation period. The time taken or days taken for this symptoms to appear is called as an incubation period. So mostly it is 1 to 3 months in humans, but it can vary from 7 months to years. So what are the pathogenesis? What are the symptoms, and what are the other manifestations of rabies? How it spreads after entering the human? How it's going to affect him? Let's see. So centripetally, we have already seen that it is an viral disease which spreads via the central nervous system. So what happens is that first of all, it's not going to enter the central nervous system because our hands are the peripheral nervous system, and then it goes centripetally to the central nervous system. So let's take this example. So say you can see in this figure what is peripheral nervous system means the nerves of the hands and periphery. What is central nervous system? They are brain and spinal cord. Only these two are central nervous system. But how the rabies virus is going to enter the CNS, that's the mystery. See, if the dog is biting their leg, mostly the dog bites on the leg level, right? So if the virus is entering into the peripheral nervous system, it travels centripetal. Centripetal means towards the center. So it travels towards the central nervous system. After reaching the central nervous system, it spreads towards the brain. And from the brain, it travels to all other part, that is called as centrifugal spread. So once it enters the peripheral nervous system, it goes centripetally, and then it goes centrifugally to all the areas. This is called as this is the pathogenesis of the rabies virus. So where does it spread? So why? I mean, like pathogenesis is important because we have to ask the patient where it is bitten, and we have to give special care for the patients who have had bit on, I mean, like dog bitten on their face, head, neck, upper extremity, genitals, and also if the animal is a wild animal like wolf or raccoon. So there is something peculiar or something common of all the three regions, all the three bulletins. What is it? Yeah, they are highly sensitive region. Face is highly sensitive, neck is sensitive, upper extremities like hands and our genitals are very sensitive, meaning they have more number of nerves in them, so they are having more nerves in them. So there is a high chance the nerves are going to the virus is going to lodge on the nerves. So that is why we are going to ask whether it is whether the dog has bitten on the face, head, neck, or upper extremities. Let me raise it. So during history taking, we are going to ask whether the patient has bitten on any of the high sensitive areas. So site is important, where it is unbitten, where the dog has bitten the patient, and severity, how gore, how deep the wound is. So that is the severity, and number of wounds. Like multiple wounds may contribute to more spread of the disease, and viral load. So this accounts to the viral load, and species, like whether it is a domestic pet or stray dog or wild animal. We are going to ask for the species. And the next thing is clothing and first aid treatment. So why clothing is important? We have already seen the virus harbors in the saliva. So let's say this is a person's leg who's having uh, full gene, and other person having their leg shorthand. I mean, like sorry, 3 by 4 pant. So this area is exposed. So we know that the virus is in the saliva. So if the dog is biting on both the legs, say here and here, so where do you think the chances of more virus is there? Obviously, no, it is this side, on the right side. Why? Because it is more exposed, no cloth is there. So the clothing acts like a barrier for the virus. So it protects the skin from puncturing. Like the teeth won't get entered, and also the saliva will not be entered into the wound. So obviously the history of clothing is important. And first aid treatment. Why first aid treatment is important? Let's see in the next slides. So there are three stages of rabies virus. This is the clinical manifestation. So one is the prodromal stage. The first stage is the prodromal stage. In prodromal stage, the person will have been having headache, and 80% cases have been reported of having tingling sensation. The next stage is the stage of excitation and stimulation. So you can say you can clearly guess from the stage, like excite and stimulate. So what is excited, what is stimulating? Let's see. So the sense organs or sensory system is stimulated, meaning he will be having all the phobias, and the motor system is stimulated. So it will be contracting. There will be spasm is there, and reflex is there, and sympathetic system will be there. What is sympathetic system? It is a system which you know the classical phrase. It is a system of fight, fright, and flight. If a person is having all these three, then he is having those symptoms. So for an example, if you are going in a traffic and you are not wearing a helmet and the police is there, what you are going to do? You will be either panicking or you will be skipping the traffic. You are going fastly and avoiding the traffic police. So in that case, what will happen? Your pulse rate will be increasing, your heart palpitation will be there, and you'll be having sweating, and you have a urge to urinate and defecate. If you have fear also, you can, we have seen in comedies, right? Person will urinate. So that is sympathetic systems symptoms. You will be having all these symptoms if you have rabies. And mental agitation will be there. So if it is a story, we can say that if during the sympathetic system agitation, excitation, you will be having phobia. All the phobia will be there. You will be having phobia for water, that is hydrophobia, and also for air, that is called as aerophobia. Like gust of air, you will be having fear for it. So what happens is that your motor system will be having a reflex towards it. So if you are drinking water, you will be splitting it or vomiting it out. So that is the reflex. And if air is there, you will be having some reaction towards the gust of air. That is the motor system. And mental agitations will be there. So all these things will cause death around 3 days. But if death is not occurring in 3 days after these symptoms, then you will be end up in the stage of paralysis and complete coma. So this is a point of no return, and death will be eventual. So how we can diagnose it? Diagnosis, how the rabies is diagnosed. So let's see. So first of all, A clear history taking, like the pathogenesis, should be elicited, and local examination of the wound, how the puncture mark is there, how many wounds are there, we have to see. And the finally we can do antigen detection. So antigen detection is done by immunofluorescence assay of skin and viral isolates from the saliva. So antigen detection is not commonly done in developing countries, but it can be done if there is a doubtful scenario and resources are available. So finally, what are the treatment for rabies? So there are no specific treatment till now. So the only treatment is avoid it. So we are going to prevent rabies cases by either vaccinating or avoiding the bite of rabid dogs. So second thing is that we will be having all the external stimuli, like air will be there, water drinking will be there. So we are going to avoid all the stimuli, and he will be having pain. Enormous pain will be there. For that, we will be giving him sedation, and then we will having spasm. Spasm is due to motor reflexes. For that, we are going to give relaxants. And finally, if we are not going to give water to him, he will be dehydrating. So for that, we will be giving intravenous fluid, and we will be giving him catheter. Finally, in the event of collapse, an ICU setup is mandatory. So these are the treatment modalities. So it is a disease of no cure. So the best thing is that we have to prevent. So prevention is better than cure is especially 100% true for rabies. So in prevention, we are going to see in three headings. One is post-exposure prophylaxis, another one is pre-exposure prophylaxis, and uh, post-exposure prophylaxis in already vaccinated patients. So let's see first post-exposure prophylaxis. Post-exposure means after the exposure of the virus, after getting bite, what the person is going to give, after what the person is going to get. Excuse me. So, so the aim of our prophylaxis is that we have to neutralize the virus before it reaching the nervous system. We have seen, right, the central nervous system and all the peripheral nervous system. So at the peripheral nervous system itself, we have to tackle the virus. So what we are going to do, we have to give local treatment and along with it immunization. So local treatment should be started as soon as possible. We have seen in our previous slides, right? Let's remember it. So first of all, cleaning should be there on the infected area by running water and with soap at least for 15 minutes. But why? Why soap and why also for 15 minutes? We can use other things, right? Because we have already seen the virus's structure. It is a bullet shaped virus, and I also told you to remember one specific part, that is the envelope surrounding the virus. So this envelope is made of lipid, that is nothing but fat. So the soap is actually a lipid solvent. It dissolves the soap, dissolves the lipid. So when soap is applied on the infected area, if the affected area is having the virus, then the virus will be uh, getting completely destroyed by the lipid layer. I mean, like the lipid layer will be destroyed. So what happens is that after the lipid layer is destroyed, the virus is naked along with the RNA. Now it can be easily killed by the immunization. So that is the reason why we tell the bitten person to wash the wound thoroughly by soap with soap. Next is chemicals. Either any antiviral like povidone iodine can be sprinkled on the area. Then suture, whether if the wound is more, like whether it is if it is like a tiger bite or if it is like a bear bite, or so many dogs have bitten the person, there will be so many sutures, so many lacerated areas, right, and he will be bleeding. So suturing is recommended. So but it is recommended only if after 24 hours under immunization. That is, it is suturing should be done only after 24 hours after immunization. So Rx, what are the drugs we are going to give for the patient? We can give antibiotics and tetanus shot can be given. Not can be given, it should be given actually for developing countries. So I think I have a bit confused you with the suturing. Actually, suturing can be given, but under immunization. If a person is having more bleeding, then suturing should be done loosely, like not tight suture, but loose suture should be done. But immunization should also be given side by side. So what are the immunization to be done? So this is the history of immunization. So first developed is nerve tissue vaccine at 2004. I mean like it is given till 2004. What is nerve tissue vaccine and why it is only given till 2004? We have seen the famous jokes, right? If you are bitten by a dog, then 16 injections should be given around the umbilicus. So actually it is a true. It is the nerve tissue vaccine which is given around the umbilicus. Since it is very painful and since it has very less efficacy, it is stopped. So sooner there is a cell culture embryonated vaccine CCEV which is developed from the human diploid cell and fetal rhesus monkey cells. So after that came the chick embryo and vero cells vaccine which is the ones which are currently in the market. So these vaccines can be stored at 2 to 8 degrees Celsius for up to 3 years. And if the vaccine actually the vaccine comes like a powder and it should be mixed with the diluent provided with the vaccine. So this solution should be used till 6 hours after the reconstitution. After mixing, it should be used only till 6 hours. After that, it should be discarded. So the most important thing that as a UG you have to remember is the WHO treatment category. This is the most simplified treatment category which I have summarized. Category 1, 2, 3. So 1 means lick on intact skin, and category 2 means abrasion with no bleeding. Category 3 is abrasion with bleeding. That is simple as can be put. So category 1 means there is no treatment. Category 2 requires only ARV, and category 3 requires ARV along with immunoglobulin or RIG. So you can take a screenshot of this if you want. So who are having more risk? More risk patients are who are bitten by the natural reservoir. Natural reservoir means stray dog or wild canines, wild other animals who generally have natural reservoir. An example like bats. Bats are known for harboring so many viruses because of their unique nature. So those animals are sure shot that they are having the rabies. So those are the natural reservoir. Or sick animal, any animal which is sick or showing some kind of odd mental behaviors like biting everyone or roaming here and there and yell, and barking at strange areas, like barking without having any persons beside him. So he is called as a sick animal. So in which case he is going to give an unprovoked bite. That is, if you step a dog on the tail and the dog bites, it's a provoked bite. You provoked him with the pain, so he bit you. But if a dog is unprovoked bite, it's like biting everyone or biting simply when you're walking, it is an unprovoked bite. So here comes another question. While we are going for a bicycle or you are driving a vehicle and the dog is coming and biting you, so it is a provoked or unprovoked bite. So that is actually a provoked bite because the dog may think that the vehicles are intruders or vehicle can stamp their small puppies or they have some traumatic injury previously. So they are avoiding the vehicles or getting fear of the vehicles. That is called as provoked bite. Other is non-vaccinated vaccine animals, and fourth more risk is saliva wound on the wound. If the saliva is there on the wound, then it is a more risk patient. So the important thing, we have two immunization. One is active vaccine and another one is passive vaccine. So once one we have ARV, anti-rabies vaccine. So this is an active vaccine. Active vaccine means it is ready-made rabies antigen with them, like attenuated or heat-filled vaccine. So it is an active vaccine. If it is injected, you will be having antibody. So that is the ARV. So it is given in two regimen. One is intramuscular and another one is intradermal. Intramuscular regiment is Eason regiment or Zagreb regiment. So intradermal regiment is modified Tide Red Cross regiment. So there are two regiments, intramuscular and intradermal regiment. In Eason regiment, that is IM regiment, 0.5 ml of vaccine, mostly 0.5 ml, sometimes it is 1 ml. So 0.5 ml it is given on the deltoid muscle on, or thigh in case of children on 0, 3, 7, 14 and 28. So that is 2, 3, 4, 5. So 5 days. In intradermal regime, the only modification, there are two modifications actually. It is 0.1 ml given on each deltoid as an intradermal route. So 0.1 and 0.1 equal to 0.2 on 0, 3, 7, 28. So what is the difference here? It is only 4 doses. Which day we are skipping? It is the 14th day. It is not there in the intradermal regime. So this is the example. So why intramuscular and intradermal regime? It is a question also. Intramuscular regime, we are using the whole of the vial. 0.5 ml is the vial's volume. So we are going to use the whole vial, and 0.1 ml is used in the intradermal regime for each side. So they have found, but why is the question? That because they have found that intradermal is more efficient, meaning the same efficacy is achieved by intradermal regime with minimal vaccines. So 0.3 ml of the vaccine is saved in the vial. So it is cost effective. But if it is cost effective, everyone can use this vaccine, right? Everyone use this route. Why only some people are using and some people are not using? It's because see, if mostly in clinics, what happens is that people who are doing practice outside, that is private clinics, they have only one or two patients per day. So they can only they can give the whole of the vaccine to only one person, because they are not going to have patients next day. So it is better to use intramuscular vaccines. While in government sector, what happens is that in OPDs there are repeated, like at least 100 patients per day comes in a good government colleges. So so in that case, intradermal vaccine is achieved and it is most cost effective. So that is the reason why both of the schedule is being followed outside. So now comes post exposure prophylaxis on previously vaccinated. If you are already given vaccine and if a dog is bitten you again, what you are going to do? So first the thing, you have to check for documentation. If documentation is there, then you are going to give two doses of ID, 0 and 3, meaning you are going to give two doses of ID injections on day 0 and day 3. Day 0 is the day of the person who comes on the vaccination, the day the person comes for vaccination. And what about pre-exposure prophylaxis? What about pre-exposure prophylaxis? Pre-exposure prophylaxis is given for persons who are having more exposures. Who are having more exposures to dog bite? They are pet handlers, veterinarians, vets, veterinarians, and municipal workers. like they will be catching the dogs, right? So they are mostly exposed to dog bites. So they are more exposed and they need the pre-exposure prophylaxis. In pre-exposure prophylaxis, 3 doses of IM or 3 doses of ID can be given. On which day? On day 0, 7, 21 or 28th day. And also they can be given of booster of the vaccine. Booster vaccine can be given if the antibody titer, that is the level of antibody in them, is below the 0.5 international unit per ml criteria. But this is not mostly done in the developing country. So for that, we are giving the vaccine, that is the full course of vaccine, instead of checking the booster. I mean, like antibody titer. What are the side effects of the vaccine? They are erythema, pain, swelling, and mild acute febrile illness. So the last one is the IG or anti-rabies serum. So this is an passive immunity. So this is a passive immunity, and it is given only once in a lifetime. Passive immunity means ready-made immunoglobulin, that is the antibody, to fight against the antigen. Only once in a lifetime is necessary, and it is given as soon as possible. And maximum can be given till 7 days from the first dose of the ARV. So what is the dose? It is 20 international unit per kg for human vaccine, human immunoglobulin, and 40 international unit per kg for the equine and monoclonal antibodies. So what is the site where it is given? It is given in and around the wound. So no test dose is required, but in some in some institution the test dose is still given, because it is better for the patient and also for the treating people to have a good confident over the vaccination. And anaphylaxis reaction can happen. So all the medications for anaphylaxis, like epinephrine and norepinephrine, should be kept standby. So these are the references, and thank you. So we'll meet soon.